Hello, my name is Jared Kaufman, and this is my capstone presentation. First, introducing my public issue, it is prescription drug prices. Prescription drug prices have significantly increased over the years, disproportionately affecting those who are low income and who have chronic conditions. Nationwide spending on prescription drugs has increased from $30 billion in 1980 to $335 billion in 2018, according to the Congressional Budget Office. An estimated 18 million people cannot pay for even one prescription medication for their household. And looking at an example here of a pharmaceutical company, AbbVie's drug Humira had a monopoly on the market from 2002 to 2023. During this time, they made over $200 billion in sales and charged patients thousands of dollars a month to treat rheumatoid arthritis. And now moving on to some legislation on prescription drug prices. The Inflation Reduction Act has lowered them or helped to control them by changing Medicare Part D. The Centers for Medicaid and Medicare Services can now negotiate drug prices for Medicare beneficiaries starting in 2026, and the out-of-pocket cap for prescription drugs has changed to $2,000 compared to the previous $7,400 and an additional 5% with no limit. And also, insurance companies offering Medicare Part D will only be able to increase premiums by 6% annually. The United States, compared to other countries, is kind of lackluster. The United States is average when looking at health outcomes like life expectancy at birth and infant mortality rates. The United States is comparable to countries like China and Colombia with these statistics. And looking at a model country, I chose France. They have better health outcomes and reviews of their health system compared to the United States, even though the United States spends almost double what France does on pharmaceuticals, comparing it to $726 in France compared to just over $1,300 in the United States. And overall in healthcare, France only spends a little over $6,000 per year, and the United States spends over $12,000 per year on every citizen. Now, looking on to why I chose this topic, I chose it because it is a common struggle among my patients who are usually beneficiaries of Social Security and Medicare. Many have explained to me an inability to afford medications, especially when they have multiple chronic conditions like COPD, diabetes, rheumatoid arthritis, things like that, and only have this fixed income from Social Security. This has driven me to dive deeper into this subject and understand how I can make a change to benefit my patients. I have shown to be capable of making meaningful changes in my community by becoming proficient in the educated citizen goals. These include effective communicator, reflective individual, and change agent. Now, looking at my first experience with being an effective communicator, I interviewed my Hispanic friend Jaime about he and his father's experiences with American healthcare, since his father is an immigrant from Mexico. He told me his father avoids receiving healthcare due to its steep costs. He noted the few times his father had gone to receive healthcare, Jaime was also the interpreter and not an actual interpreter. During the interview, he seemed kind of embarrassed to tell me certain details, and I had to do my best to be respectful of what he wanted to share. From this experience, I learned how sensitive healthcare is to some people. As a child, I always had access to healthcare. This experience showed me not everyone has this luxury, and I also learned what it takes to be an effective communicator by showing respect and empathy when Jaime was embarrassed to answer specific questions. Tying this back to my public issue, Many struggle with healthcare due to its staggering and steep costs. I will keep everyone in consideration when addressing prescription drug prices and be cognizant of their specific challenges that they face. Also, when interviewing others, I must respect what they want to share with me. Moving on to my second effective communicator experience, I researched and wrote a paper about cystic fibrosis, ultimately leading to a presentation at the end of the semester. This required practicing my verbal and nonverbal communication skills. After tailoring my presentation or PowerPoint to my audience and making it interactive, I successfully presented it to the class. I learned the importance of having an interactive presentation. It could have easily been a boring 10-minute lecture about cystic fibrosis, but I included pictures and asked questions to keep the audience engaged. I also used nonverbal skills like hand movements to further engage the audience and effectively communicate my topic. Tying this back, when advocating for changes to prescription drug prices, I must present my ideas effectively. This presentation allowed me to practice these skills before giving future presentations about necessary legislative changes. Moving on to being a reflective individual, my first experience was when I participated in a clinical simulation with other nursing and respiratory students. The simulation required me to use my skills without the help of an educated or a clinical instructor. The simulation was helpful, forcing me to use my critical thinking and communication skills with other providers to effectively care for the patient. I learned the importance of staying calm and having confidence in myself and my peers. It showed me the importance of working well in a team because caring for a patient is not a one-man job. It includes many healthcare professionals like doctors, nurses, respiratory therapists, radiation therapists. There are too many to name, but it takes a whole team to care for a patient. And looking back at my public issue, when advocating for prescription drug pricing change, I must have confidence in myself and work well with others to make this happen. Altering legislation requires many people, making it essential that we can work well together to achieve the common goal of making prescription drug prices more manageable. And looking at my second experience, I had a patient at my job as a respiratory therapist who was not oxygenating well and was going to require intubation to have a chance at survival. The patient was very apprehensive, even after extensive education, and decided to wait much longer than recommended to do so. It was not until the daughter arrived that she changed her mind and wanted to proceed with the intubation. From this experience, I learned the true meaning of patient-centered care. Even though it was not the right choice in my opinion, it was up to the patient since she was coherent and understood the consequences of not being intubated. Respecting the patient's wishes is essential to our healthcare system, and I learned how to respect those decisions. Looking back at prescription drug prices, in my journey to change them, I will come into contact with individuals who think differently from me. It is important to respect these opinions and do what I can do to educate them and help them see my point of view. If they continue to disagree, that is their decision, and there is nothing I can do to change that. And finally, looking at my change agent experiences, my first one is in my first year at Nebraska Methodist College, I was part of a new soccer league. After one of these games, I gave a player named Alejandro a ride home. After doing this multiple times, we became pretty good friends. I learned about Hispanic culture and the challenges he and his family face. They did not have much disposable income, and he chose to spend all his money on this soccer league. After more research, I found this to be true for many Hispanics, along with facing many other social disparities. From this, I developed an understanding of the struggles Hispanics face every day. I learned that some of this can be attributed to racial biases and not having enough education to get anywhere in the United States. Tying this back to my topic, Hispanics and other minority groups share the challenge of not having disposable income. With the exorbitant costs of prescription drugs, it's almost impossible for these groups to afford their medications on their own. I must fight for these groups and work to make changes to help them afford their medications. And looking at my final experience as a change agent, while working as a respiratory therapist, I helped resuscitate a transgender woman multiple times after she experienced a series of panic attacks. Once stabilized and transferred to the intensive care unit, she started crying and asking for forgiveness as she said, "This is all my fault. I'm so sorry." Immediately, all of us comforted her and assured her this was not her fault. When telling the next shift about the patient, they were skeptical. Their initial impression was this was for attention, and I made sure to explain this was not for attention and was to be taken seriously. From this, I gained an understanding of the struggles transgender people face and the mental health challenges they have. I also learned how other people view this group of people and the education that they need to effectively care for them. Tying this all back, many people who do not understand the struggles of those who cannot afford prescription drugs. It will be one of my missions to educate these people, ensuring they know their struggles and how they can help. And in conclusion, to be an educated citizen, one must be an effective communicator, reflective individual, and change agent. Throughout my time at Nebraska Methodist College, I have shown to be proficient in these goals. I am excited to continue to grow as an educated citizen personally and professionally in my job as a respiratory therapist. I want to thank you, Nebraska Methodist College, and my instructors for giving these opportunities. I look forward to my future adventures.